is the topic given to me by Dr. Biko, energy sources in surgery, not in Nepal, as announced by our MC. So have you ever think doing surgery without using any kind of energy sources in your OT at today? I don't think any of you have think about it, but I had some experiences while I was in Patna Hospital. One of my professors used to tell us that if you do not have the cautery, if you have to share with other OT, why don't you use without cautery? Why don't you do the surgery without cautery? So we also tried sometimes, but ultimately we had to use it, some kind of energy sources to complete our surgery. So I will try to make the time as short as possible to compensate others. So there are different types of energy sources we can use in our operation theaters. One of the most commonly used is the radio frequency electrosurgery devices, which we used to call it cautery. Everybody knows cautery. So this is synonymous already in most of the places, even in our centers. And the fourth one is the argon beam coagulations. This is some kind of expensive devices. Even the laser is expensive. And the last one is the radio frequency. This is very much similar to the radio frequency electrosurgery. The radio frequency, the principle of this radio frequency energy device is very much similar to the first one, the cautery. But nowadays, it is emerging, the fifth one. So we'll discuss one after another. The radio frequency electrosurgery is first used by Dr. William in 1920. It is reported in the literatures. Then it was well known as the RF knife, radio frequency knife. Sometimes it's also known as Bowen's knife. But some other literature also says Hippocrates has used this kind of instruments, this kind of energy sources while doing the hemorrhoids. But I hardly believe this. Maybe those kind of papers are published by the colleagues of Dr. Williams, I guess. So the principle of the electrical circuit in the radio frequency electrical surgical units is here in the picture. So there is the patient there, and the electrosurgical unit generator is here, and it is the active electrodes going there, and once the electricity or the current is passed through the tissues, and all the electrons is collected by the passive electrodes, and then transmit to the generator again. It has to be completed, the circuit, otherwise it won't work. If there is some short circuiting from patient to earth, then it won't work. We will be having disaster then. So we must think about all those things, though it looks very minor. That's why I think this topic is kept here. So this is the electromagnetic generator. This is a very simple one. It has only very few functions, as you have seen or must have used in your daily practice. But this is not as simple as it's seen by you, because the energy, the electricity, alternate current, which is received by this generator, something like 50 or 60 hertz, is step up to 1,000 times higher than the input. So the output current it produces will be something like 500,000 hertz or 500 kilohertz, which is tremendously high in compared to the input. That is why this kind of instrument can produce adequate amount of heat in short durations of time, and it also can produce lots of complications if you do not use it properly, and if you are not aware of the complications, so you might be landed with severe consequences. So this generator will give electromagnetic energy, will convert it to the kinetic energy. As we know, energy can neither be created nor be destroyed, but it can be transferred from one form to another. I am teaching you physics, not the surgery here. And the kinetic energy will be converted to the thermal energy. Once the thermal energy is generated by the generator, and it will deliver to the tissue of interest and the functions. There are different types of reactions we can see there. So what are those? Okay, the thermal energy thus produced can give different types of effects in the tissues according to the temperature. The temperature gradually increases from low to the high in this kind of surgical devices. If the temperature is very low, something like below 70 or 70 to 80, it will give the coagulation effect. If the temperature further increases, so it will give the desiccations or dehydrations of the tissues. If the temperature becomes something like around 100 degrees centigrade at the boiling point of water, it will vaporize the water content of the tissues of the cell. If the temperature further increases by the generator, you can adjust the temperature, so it will fulgurate or carbonization of the tissue will occur. You must have seen blackening of the tissues while you are burning the tissues. That means the temperature is very, very high than you require. So it is something like more than 200 degrees centigrade. So in such conditions, fulgurations and the carbonizations of the tissue occur. All those things, once again, I'm telling you, this is physics. All these things depends on only one law. This is called Ohm's law. You must have gone through this even in your school life. So basic principles given by the Ohm's law is, if the resistance is high, there will be production of heat. This is the simple thing you have to remember. Even though you do not remember the law itself, if the resistance is very high in between the two different ends of the volts or the electric current, there will be heat productions. If the resistance is low, the production of heat will be low. This is the basic principle of this electrosurgical generator. So here, while you're using the tissues, while you're using coagulations or cauterizations of the tissue, if you take bulk of tissue, there is a low resistance. There will be no increase in temperature. The temperature will be very slow or low. So there you can't get the desired effect that you want. If you took very small amount of tissues while doing the cauterizations or coagulations, it will take hardly milliseconds to get the desired effect. That means the resistance is very low, the heat is tremendously high, then you will get the effect. So in this simple device, we have two different basic functions. One is the cut, as you know, is cutting the tissues. In the cutting mode, it will run at the low voltage, but the duration will be very long. And it will be continuous again. You can see from the graph here, the current will be continuous, uninterrupted. The voltage will be very low. It takes long time to get the effect of cutting. On the other hand, if you go to the coagulation mode, so voltage will be very high, and it is not continuous. It is pulse, in the pulse. It comes and goes, and that will be in for short time only. So what will happen? In case of cord, there will be very low voltage, and it takes long time, and the energy will be increasing one after another, higher and higher and higher, till there will be higher energy and explodes the cells. So it will give the cutting effect at the tissue. On the other way around, in the coagulation, there will be high amount of energy, but in the pulsatile mode. It will just hit the tissues, and you will stop it, so that the protein inside these tissues or the protein inside the cell will denaturate pulse by pulse, and they will be having coagulation effect, sealing of the vessels at the radius. So this is the basic difference between the cutting and the coagulations. Now all the things, whatever we are talking up to now, is all depends on the temperature of these devices that produced by these devices. So temperature or the heat can be increased or decreased by altering all those four different functions. One is you can increase the current of the device to increase the temperature. You can decrease the surface area of the tissues. If the surface area is tissue, there will be increase in the resistance, again the temperature will be high. Or you can increase the temperature by increasing the resistance. Or you can increase the durations. You can increase the durations of applications of your cautery. In such conditions, the temperature will be high again. So the basic, there are two different modes in these electrosurgical units. One is the monopolar and one is the bipolar, as you all know about it. But here, the difference between the mono and the bi is, in the monopolar, there is a passive electrode will be very with a high surface area, and it is completed, the circuit is completed through the patient, whole body of the patient, or the tissue in between the active and the passive electrodes. Whatever is the tissue in between these two electrodes. Unlike in the monopolar, in the bipolar, so you can see there, the tissue in between the two electrodes are very minimal. The electricity has no need to pass through the whole body of the patient. Again, one more difference here, I would like to say it here, this is the one. Always the monopolar diathermy needs grounding, unlike in the bipolar. However, the coagulations, the amount of heat generations, everything is almost similar to the mono and the bipolar. So we'll come in. So in case of monopolar, so this is patient, this is active electrode, this is passive electrode, this is electric generator. Whatever is the electricity generated by this generator will be transmitted by the active electrodes and delivered to the tissue. And after completion of this job, all the electricity, all the electrons given by these active electrodes must come back to the generator through this passive. If you have any leakage here, the electron not necessarily will come from this passive electrode. It might leak from other way around, giving unwanted effect. So you have to be careful about this. So most of us do not care about this passive electrodes. We always think about the active electrode is the main thing, but it is equally important as the active electrode. So these are the monopolar hand instruments. It can produce different types of tissue effect like cut or blending, desiccation and fulgurations. Blending is nothing, it's just mix of the cutting and the coagulations. It's the hybrid. Again in the bipolar, as shown in the pictures, the bipolar has the two active and passive electrodes at the same time. So only the electricity is passed in between these two electrodes. There will be no effect at all in the other parts of the body. Because there is very small current flow in between these two electrodes, the electricity will be very small, low in voltage, so that it can't give the cutting effect. It can give hardly coagulation effect only. This is not good for the cutting purpose. It is good for the coagulation purpose. And it is best for the coagulations for the small vessels, where you can get these vessels easily by both of the sides. If you can grab the vessels by both of the end, so this is good device to use. So it gives the low voltage, so low energy. It can give the cutting effect. It can give only the coagulation effect perfectly. This is the bipolar. You can use even in the laparoscopic. I can see it here because of this light. Laparoscopic and the open surgical field. So what are the advantages of monopolar electrosurgery? It is very simple equipment. Everybody can use it. And it's cheaper, it's cheapest I should say. And it can be used for the operating time is very short because it can produce heat immediately more than desired. So operating time itself is very short, unlike in other devices. We'll come on it. And For the skin incision, this is the best device. If you have to do the skin incision by the electrosurgical units, then this is the best device for that. However, it has some disadvantages also. It can give the injury to the patient through the direct or capacitive coupling effect. If there is insulation is failure, we will be having loss of morbidities will come in again. And there is another thing is burn due to the return electrodes. And again the monopolar, while you are using the monopolar, you have to take care about the electrical devices that is implanted in the patient, something like pacemakers or other devices which is electrically active. And there is always risk of the flame or the fire at the OT while using the monopolar. It gives significant amount of smoke. This is hindering our operating field. And the high temperature at the tip of the active electrodes is another disadvantage of this equipment, because it won't get cool immediately, unlike in the ultrasound. So it keeps on heating for a long time. If you leave those cartridges unattended, it might give problems to you again. And the thermal effect of this monopolar is very high. You won't be knowing that up to which level the thermal effect has transmitted from the point of generating the point of starting. Similarly, the bipolar electrosurgery has some advantages. So the current will passes from active to the passive electrodes in very short distance. It will give the very small thermal effect. NCL is one of the bipolar electrosurgery unit, though this is not only the electrosurgery, it has some other combination technology also. It is good for the vessel sealings, small vessels. As I said, you have to take the vessel from both sides. And it will give the equal peak temperature on different types of the tissue, regardless of the tissues and the thickness. Some disadvantages of the bipolar electrocautery are the operation time is very long because it gives very low heat and slowly. And the amount of the thermal energy produced by this device depends on the power settings and the skill of the surgeons, how they use it. And it also produces the smoke. Sometimes it gives trouble to operating field. Now, this slide is very important for me. This is taken from the American journals, and it says something like 40,000 cases per year are reported as born due to the electrosurgical units in US. And the next line is again further important. Out of 40,000, more than 70,000, 70% of the cases are unknown. It's not treated at the time of surgery. That is why this is very important to know how to use those kind of equipments safely. So some electrosurgical accidents that might happen with these devices are the burn cases and the explosions. Explosions happens when tremendous heat is generated in presence of the inflammable fuel, most of the anesthetic agents, and when the oxygen is present, there the flame burn might happen, or even the explosions. It might give the interference with the implanted medical devices which is electrically charged. If there is failure in the insulations, so it might give the coupling effect or capacitive effect. It might give the thermal injury to the adjacent structures or the organs. We won't know how much heat has transmitted while using this corporate. And it might give the dispersive electrode bonds because of the passive electrodes, on not properly placed passive electrodes. So I try to make it clear with these pictures how the direct coupling is happening. This is your laparoscopic device. Those are the things you can see most of the times in laparoscopic surgery rather than in open surgeries. So this is a laparoscopic instrument. If the insulations of this instrument is breached somewhere, so we won't be knowing that, small holes. From there, the electricity will be leaked and it will transmit to the adjacent structures that will cause burning or cutting effect without knowing to surgeons. That is called the direct coupling. Another one is indirect coupling. This is the laparoscopic instrument. This is another instrument. So there is no breach in the laparoscopic instrument here. So this another instrument is electrically active or good conductors for the electricity. Sometimes the cautery hook, sometimes the laparoscope itself, needle holders, aspiration needles, retractors. Those are the instruments we have to take care. So at the time of using those high energy devices, it might be touching to other devices. So at the same time, it will give deleterious effect in the other organs which is touching to the unwanted instruments. So this is called indirect coupling effect. But sometimes we will get advantage of that indirect coupling effect also while doing the surgery. It is how, when we are taking tissues that need to be coagulations, so we will be taking from the one hand and we will be doing the indirect coupling effect from the other hands. But this is not for the junior surgeons, so take note. So we take, so on is the capacitive coupling. You take me with the time line. So dispersive electrode bonds, I have talked about it. If you do not properly keep this passive electrodes, it will give the same effect as the active electrodes. Whatever is the energy generated here will be dissipated here and it will give the burning to the patients. So I have to run. So this was about the electrosurgical units. Now the ultrasonic energy systems. This is first used in 1960s and is popularized by the Amaral in 1980s. This is almost similar to the previous one. The only difference is the electric current which is generated by this device is converted to ultrasound by piezoelectric transducers. So mechanism is the low frequency mechanical vibrations at the tip of the tube will create the vibrations. That vibration will transmit to the tissues and it will cause friction to the tissues or the cells and it will give the cutting effect or the dissection, tissue dissection effect. Now the ultrasonic system has used the frequency of 20 kHz, which is higher than the audible. It will give the similar effect as the electrosurgical units, something like cutting, coagulations and the drilling, but the cavitation is different than or is peculiar to the ultrasonic devices. It will give the vibration of the tissues. It will give vibrations. It will give tissue to be vaporized. So it's called the cavitations. So if you compare those things, ultrasonic devices with the other electrosurgical devices, the thermal space is very low in compared to the other two, monopolar and the bipolar. This is safety of these ultrasonic devices. Again, if you compare with others, monopolar and bipolar, the ultrasonic has a very low latent thermal effect and it can give very good effect in the cutting as well as in the vessel sealings. So I'll just skip. Thunderbit is one of the example of the ultrasonic devices that we have been using daily. So advantages, it produces a very low heat. It won't produce the smoke at the time of surgery, and it is safe compared to the electrosurgical units, and it will give lesser operating time. Again, disadvantages it has. It can give only the effect at the desired area, something like 2 mm of tissues. So if you want to make it higher, so you won't get this desired issue in the more than 2 mm. So this is the most disadvantage of the ultrasonic devices. So now let's go to the laser. So laser is another very useful and the very popular devices. Nowadays in our center also we have been using lasers. So laser, the mechanism, as you all know, this is electromagnetic light waves that's amplified and concentrated in the tissues. So it will give the heating effect. So one more thing here, one thing I would like to highlight here is laser is mainly, the energy source of the laser is mainly depends on the irradiations. This is defined as the power per unit area. Not only the power and the area here in the lasers, you have to take note about the time and the wavelength what you have used for the tissues. So you have to take note even the time, durations of the lasers and the wavelength you have chosen. So that it will also increase or decrease the power of the lasers. So there are three different things you can do with the lasers. One is the photothermal effect you can get. Another is the photochemical effect. If you desiccate or if you fulgurate the tissues and if you burn it, so it will call the photothermal effect. If you just denaturate the amino acid or denaturate the protein in the tissues, it will just instead of generating any other high heat, so you will get the photochemical effect. So one more effect you can get the photoplasma effect. They will be producing the plasma. If you use the high energy of the lasers, so they will be producing the plasma. The plasma means the high energy electronic charge devices. So it will cause the photoplasma effect to the tissues. So there are two different types of lasers. One is non-contact, another is contact. There is no difference in the contact and non-contact. Only difference is the tissue intervening, tissue in between the charging laser device and the tissue or not. If there is tissue in between the laser fiber and if there is medium in between the laser fiber and the tissue, this is called a non-contact. If your laser device is directly contact with the tissue, it is called the contact type. This is basically the same. Only the difference is how safe is the tissue. Okay. So there are different types of laser devices. According to the use, you have to choose the laser devices. So most of the laser devices we use is the ND-YAG laser devices. This is used in the skin, thyroid, so on and so forth. And there are other argon lasers, fluoride. There are so many other lasers type also. So there are some advantages, disadvantages. I'll just skip it to complete it. Argon beam coagulation. Should I stop or what? So I have very few slides. So argon beam coagulation is another newly invented devices. One of the invented devices. So it is used the argon gas. Argon gas is used as a medium to deliver the energy. I'll just show these pictures. This one, if you can see, this is the argon beam. So argon beam is the gas is the medium to deliver the electricity or the electrons from this active electrode to the tissue, so that it will give the heating effect. The one guideline is given by the American societies is that to avoid these complications from the argon, one of the complications is the gas embolism. So there are three different things you must take note about the argon beam coagulation. One is the flow rate of the argon should be as low as possible, and there should not be direct contact with the tissues, and the beam should be in the inclined position, not in the vertical position. So if you think all those things, three things, so you can avoid complications of this argon beam coagulations. Radio frequency is another very newly launched device. This is almost similar to the first one, as I say already. So this is mostly used for tumors, renal tumors and liver tumors. Okay. So in this case, so the frequency is used in the 3 kilohertz to 300 megahertz only. It means very low frequency. It takes very long time to desiccate or fulgurate the tissues. So it is used most commonly in the minimally invasive surgery and the percutaneous settings. Nowadays, this is very popular in the percutaneous settings where the surgery is not possible to the patients. And if you have to fulgurate or if you have to ablate the tumors, then you will be using this radio frequency ablations. So it can be mono or bipolar, as always. It's more useful in the liver and the renal tumors. So we are using this kind of devices in our center also for varicosities of the legs and veins. So complications, the pacemaker requirements may be there, the frenulum pulses, transient ischemic attack will be there, some pulmonary embolisms might be happening by using the radio frequency. So my references, I'm sorry for the, thank you. Those are the two different things we have to alter it to choose the depth of the laser. If you use the higher wavelength, it will penetrate deeply. If you use long durations, again it will penetrate in deep tissues.